Hello everyone, so let's talk about which blood tests require fasting. Your doctor or laboratory tells you, come fasting for your blood test, and suddenly you have so many questions. Can I drink water, morning tea, or take regular medicines? Does every blood test require fasting? The answer is no. Not every blood test requires fasting. Some tests need fasting, some usually don't, and some depend on exactly what tests your doctor has ordered. So, in this video, let's understand which tests require fasting, whether you can drink water, what happens with tea and coffee, what about milk and juice, what about your medicines, how long you may need to fast, and what do you do if you accidentally eat, and most importantly, I'll explain why so you don't have to memorize everything. Let's make blood test preparation super simple. First, what does fasting actually mean? What does fasting actually mean? So, when we say fasting blood test, we generally mean that you haven't consumed food or calorie drinks for a specified period before the blood sample. For many tests that require fasting, the fasting period is commonly around 8 to 12 hours, but the exact duration depends on the test and the laboratory's instructions. Now here the important thing is fasting does not usually mean no water. For many fasting blood tests, plain water is allowed. So if your laboratory tells you to fast, you generally don't need to avoid plain water unless they specifically instruct you otherwise. Why? Because plain water contains especially no calories, does not provide the glucose, fat or other nutrients that food and calorie drinks provide. Staying hydrated can also make blood collection easier because dehydration can make finding and drawing blood more difficult. But remember, water is different from tea, coffee, milk, and juice. Those may contain calories or other substances that can affect certain test results. So, always follow the specific instruction given by your physician, doctor, or family. Fasting blood glucose. Let's start. Fasting blood glucose. Let's start with the most common test, that is FPG or FPS. Fasting plasma glucose or fasting blood glucose. This test measures your blood glucose after fasting. It may be ordered to screen for diabetes or pre-diabetes, evaluate suspected diabetes, assess glucose levels in certain clinical situations. For a fasting glucose test, you are generally asked to fast for at least 8 hours during this period with no food, juice, milk, tea, coffee, plain water, plain water is allowed. Why? Because eating or drinking calories can increase blood glucose. The doctor wants to know what your glucose level is after fasting rather than after a meal. So fasting glucose is equal to fasting is part of the test. And next test is OGTT. OGTT means oral glucose tolerance test. This test checks how your body responds to a controlled amount of glucose. When is it done? It is done in selected situations to evaluate diabetes or impaired glucose tolerance. It is also commonly used for gestational diabetes testing during pregnancy. According to the testing protocol being followed, here's how it works. First, you fast, then a blood sample is taken. Next, you drink a measured amount of glucose solution. Then you wait for a specified period and additional blood is collected. So remember, fasting, blood sample, then glucose, you drink glucose, then you wait for some time, then another sample is being collected from your blood. The doctor wants to see how your blood glucose changes after receiving a standardized amount of glucose. That's why you need to follow the preparation instructions carefully and don't worry about the glucose drink. The drink is part of the test itself. The third test is HbA1c. What is it? Now let's talk about a test that people often confuse with fasting blood glucose. Okay, both measure glucose, but This HbA1c measures the amount of glucose, average blood glucose, over in the past 2-3 months. Average blood glucose in the past 2-3 months. Okay. When is it done? It can be used for screening of diabetes or pre-diabetes, helping diagnose diabetes, monitor people with diabetes, and assessing long-term glucose control. Does it require fasting? No, that doesn't require fasting. You generally don't need to skip breakfast just because you're having a HbA1c test. Why? HbA1c measures the amount of glucose attached to the hemoglobin, in your red blood cells, because red blood cells circulate for several months. HbA1c reflects longer term glucose exposure rather than simply showing what happened after your most recent meal, like your fasting blood sugar. It is different and this is different. Both measure the glucose, but this measures past 2-3 months glucose. And so it's clear, I guess, both are different. Random blood glucose, as the name itself suggests, it's measurement of it measures random blood glucose as a name. And this test can be performed anytime with fasting or without fasting. When do we do this random blood sugar test? In order to assess a patient has symptoms suggesting abnormal blood glucose, a patient glucose measurement is needed, immediate measurement is needed, or a patient is in hospital for emergency setting. Fasting isn't practical. Fasting, usually you don't need this. Why? Because the purpose is to measure your glucose at any particular moment regardless of when you last ate. So we don't need fasting in this case. We don't need in this case also. And the next test is CBC. Most of us might have done it. Now let's move away from glucose. CBC, complete blood count. This is one of the most commonly ordered blood tests. CBC provides information about red blood cells, white blood cells, hemoglobin, platelets, and it may be ordered when doctors are evaluating anemia, suspected infection, fever, unexplained weakness or fatigue, bleeding, and certain chronic diseases. So sometimes even for fever they assess your CBC. Okay, that's the reason. Why? Because a routine CBC is mainly evaluating your blood cells and their characteristics. You generally no need to skip just because you are having a CBC. Don't skip your meals for CBC. However, if your doctor has ordered a CBC together with another test that requests fasting, you must still be instructed to fast. And here we go with the next test, thyroid test. As you see, this is thyroid gland. The most common tests include TSH, free T4, sometimes free T3. When are they done? The doctors may order thyroid tests when a person has symptoms such as unexplained weight gain, fatigue, palpitations, heat intolerance, cold intolerance, changes in bowel habits, menstrual changes, neck swelling. Okay. They are also used to monitor people who already have thyroid diseases or receiving thyroid treatment. Does thyroid testing need fasting? No. This test generally don't require you to be in fasting state, but there is another important point, medication timing. So if you are taking thyroid hormone replacement such as levothyroxine, don't randomly change the timing of your medicine before blood test. Ask your doctor, should I take a thyroid medicine before or after the test? Here we go with the next test, lipid profile. So why do we do this? It is done to know total cholesterol, LDL cholesterol, HDL cholesterol, triglycerides, fasting. What does LDL mean? Low density lipoprotein. HDL is high density lipoprotein. HDL is good cholesterol and LDL is bad cholesterol. When is lipid profile test done? It may be ordered for cardiovascular risk assessment, cholesterol screening, and patients with diabetes or cardiovascular risk factors, lipid disorders, patient with lipid disorders, abnormal lipid results. So in order to monitor all this, they suggest lipid profile tests. Does it require fasting? Not always. Many lipid tests can be performed without fasting, and however, your doctor may specifically request fasting in certain situations, particularly when triglyceride need careful assessment or according to the clinical situation and laboratory protocol. And why food can temporarily affect some lipid measurements. Why do we need fasting? Food can temporarily affect some lipid measurements, particularly triglycerides. So don't automatically think lipid profile means fasting. Follow the instructions given by your doctor. Next, liver function test. Liver function test, LFT. Depending on the laboratory, these may include AST, ALT, ALP, bilirubin, albumin, total protein. When are they done? They may be ordered when doctors are evaluating jaundice, hepatitis, abnormal liver tests, chronic liver disease, suspected liver disease, unexplained liver abnormalities. Does LFT require fasting? Does LFT require fasting? As you see, may or may not require fasting. Not necessarily. The requirement depends on the exact test order and the laboratory instructions. Why? LFT is actually a group of different measurements. Not every component is affected by food in the same way. So don't automatically tell a patient LFT means fasting. Instead, ask what exactly has been ordered and what preparation did the laboratory recommend. As you see, not all liver tests are affected by food. Depends on the panel. Let's go to the next test. Kidney function test, metabolic panels. Metabolic tests. Kidney function tests or metabolic panels, depending on the panel, they may include creatinine, sodium, potassium, chloride, urea or bun, bicarbonate, glucose, and other chemical measurements. When they are done, when are they done? They may be ordered for what kind of diseases? Suspected kidney diseases, acute kidney diseases, dehydration, electrolyte abnormalities, and hospitalized patients, chronic kidney disease patients. Does it require fasting? Does it require fasting? Not every kind. Every kidney function test requires fasting. Why? Sometimes because the exact panel can contain different measurements. If glucose or another fasting sensitive measurement is included, fasting instruction may be given. So remember, KFT, kidney function test, does not automatically mean fasting. Next, let's go to the next disease. Iron studies. Now let's talk about iron studies. These may include serum iron, ferritin, TIBC, transferrin saturation. When are they done? They may be ordered when doctors suspect iron overload, iron deficiency, abnormal blood count, nutritional deficiency. It depends on do we need to fast for this? It depends on the specific test and laboratory protocol. The most common question is, can I drink water? Yes, plain water is generally allowed while fasting because water has no calories, as I already said you in the beginning. Vitamin D test, another very commonly requested test. When is it done? It is done when suspected vitamin D deficiency, bone health concerns, malabsorption concerns, monitoring supplementation is selected. Do we need any fasting for this? No. And most asked questions like, can I drink coffee, milk, juice, and all this? So water, you can always consume water. What about Tea or coffee, as I said. This is where people accidentally break their fast. They say, I didn't eat anything, I only had tea. But what was in the tea? Milk, sugar, maybe both. The sample applies to coffee too. Why does it matter? Because you are no longer consuming only water. Calories and nutrients can affect certain blood measurements. So, if you have been instructed to fast, don't assume tea or coffee is allowed. When in doubt, choose plain water. Even milk and juice, these contain protein, fat, carbohydrates, calories. So you do not or you should not consume all these. What about medicines? Now please pay attention to this part. Should I stop my medicines before a fasting blood sugar? Should I? Never stop your medication on your own. Different medicines have different instructions. Some can be taken normally, some need to be taken with food, some can affect laboratory results, and some diabetes medicines can cause hypoglycemia if taken while fasting. Therefore, ask your pharmacist, doctor, family if you are unsure. This is particularly important if you are taking medicines for diabetes, heart conditions, BP, seizures, thyroid disease, and blood clot prevention. Special warning for people with diabetes. If you have diabetes, fasting requires special attention. Some glucose lowering medicines can cause low blood glucose to fall when you aren't eating. This can lead to, sweating, trembling. As I said, fasting with diabetes can lead to hypoglycemia. This can lead to sweating, trembling, palpitations, dizziness, confusion, weakness. What should I do with diabetes medicine or insulin? The answer depends on the specific medicine and your clinical situation. Never change your dose yourself. Okay? When should you have the test? If your test requires fasting, a morning appointment can often be convenient. Why? You can have your normal evening meal, begin the required fasting period overnight, sleep through most of it. Not everyone needs exactly the same fasting duration. The correct duration depends on the test, so follow the instruction given by your physician. What should I eat the night before? Should you eat a huge meal before fasting? No, don't think. Tomorrow I'm fasting, so tonight I'll eat everything. Instead, unless you have been given a specific dietary instruction, eat your usual diet. Don't deliberately overeat. Don't suddenly consume an unusually fat meal. The goal is to obtain a clinically useful result, not to manipulate the test. What if I accidentally eat? Now suppose you are supposed to have a fasting blood test, but you forgot, you had breakfast. Don't panic. Don't pretend you're fasting. Tell the laboratory what you drank, what you ate. The laboratory or the doctor can decide whether the test can be still performed or not. The big fasting chart. Okay, as I said, when should I have my blood test? When should I eat the night before? What should I eat? Do not overconsume, do not overeat. What if I accidentally eat? You should always inform the laboratory, a physician, because they will decide whether the test to be done or not. And the big fasting chart. Generally request fasting. Fasting may not be required. Fasting must and should. Well, what is that? For fasting plasma glucose, usually 8 hours, and for OGTT, fasting before the glucose drink. These both generally require fasting, and lipid profile and metabolic panels may or may not require fasting. CBC, H1AC, HbA1c, random glucose test, TSH, free T4, free T3. These usually do not require fasting. This is the chart. Okay. And the complete picture is shared in our Telegram channel. Do join. Next, what can you have during a fast? As I said, only water. There you go. Rapid fire quiz now. Let's not show you the. So, question: does a routine CBC require fasting? No. Does HbA1c usually require fasting? No. Does fasting plasma glucose require fasting? Yes. Can plain water usually be consumed during fasting? Yes. Can you automatically stop all your medicines before fasting? No. Can you drink milk? No. As I already explained, these are all simple topics and simple questions, but these are must and should be followed before you go for any medical test, because your simple mistakes could lead to a big blunder in your results. So please follow. And here's your family goal. Fasting is not test specific, not blood test specific. Don't simply ask, do blood tests require fasting? Ask, does this particular test require fasting? And then consider what is being measured. Was the test ordered? Why is it ordered? What medicine is the patient taking? What is the patient's clinical situation? Like, I want all the familians to concentrate on this. What is being measured? Why was the test ordered? What medicines are taken? And what is the patient clinical situation? And what preparation instructions has the laboratory provided? Okay, not the final recap. So before we finish, remember these 5 things. Not every blood test needs fasting. Fasting glucose and acidity generally require fasting. HbA1c, CBC, random glucose, and thyroid tests, they don't need fasting. Plain water is generally during any kind of fasting. Okay, any kind of fasting blood test. Never stop or change your medicines without appropriate medical advice. And if you accidentally eat, don't hide it. So the next time someone says you have a blood test tomorrow, so don't eat anything, you can ask now, which blood test? Because not every blood test needs fasting. So if this video helped you understand blood test preparation, share it with your family, friends, nursing students, pharmacy students, medical students, or anyone who. I'm a family girl. Subscribe for more simple evidence-based medical explanations without complicated medical jargon, because understanding your health is better than simply memorizing it. I'll see you in the next video. Thank you.